So, Lucy, do you know anything about gold?
Gold jewelry, you mean?
Not quite. I do love gold jewelry, but not gold jewelry. Gold is actually the name of a program that is specifically designated for patients like Mrs. Tubbs.
Okay.
So, Mrs. Tubbs, like I said, has chronic obstructive pulmonary disease. And GOLD, which is the Global Initiative for Obstructive Lung Disease, created a program to address that disease complex in patients.
Okay.
And I know what you might think, what happened to the little I in initiative? Well, you can't spell anything with the I, so they took it out, but it's in the whole phrase. And this is a very special program. Most people who have COPD at some point will have participated in some part of one of Gold's therapies or protocols or programs during the lifetime of their treatment. So, a little bit about them that's not really indicated here, but Gold actually is like I said, it's a global initiative. It's in over 40 countries across the world. This is from Canada to China to Japan to Africa,
Mm.
all over the world, because you got to realize obstructive lung disease can happen to anyone.
Okay.
And of course, there's certain risk factors that make someone more susceptible, but in every country, they always have someone that might have it. And they have several leaders globally that participate and lead portions of their country in that health effort. So I actually have the pocket guide here with me, and it's very long, but it's okay. There's a lot of excellent information we're going to go over before we get started with Mrs. Tubbs today. It was actually updated this year, but this is the 15 edition. And there's the same protocols and details that we're going to go over that haven't changed.
Okay.
So,
One of my family members has COPD.
oh really?
He has trouble breathing, and if this could help, I sure would like to know how.
Well, that's awesome. There's a lot of information that's in this packet, but there's also online even more resources. So when we get done today, I encourage you to go online and look at some of the extra details. So in explaining COPD, let's go over some of the major basic details. So chronic obstructive pulmonary disease is a major cause of morbidity and mortality throughout the entire world. Much has been learned about COPD since the Global Initiative for Chronic Obstructive Lung Disease issued its first report, Global Strategies for Diagnosis, Management, and Prevention of COPD, in 2001. The treatment of COPD is now aimed at immediately relieving and reducing the impact of symptoms, as well as reducing the risk of future adverse health events such as exacerbations. These dual goals emphasize the need for clinicians to maintain a focus on both the short-term and long-term impact of COPD on their patients. A framework for COPD management that matches individualized assessment of the disease to these treatment objectives will better meet each patient's need.
Okay.
Does that kind of help explain a little bit about what GOLD does?
Mm-hmm.
Awesome. Okay, so I just pulled up the GOLD website for you just to see a little bit about what it looks like. And let's just go over a little bit more detail about what COPD is, okay?
Great, because I wanted to know what really was COPD. Okay.
I understand. It's a lot more complicated than it sounds like. I know that you asked me what is COPD, and I want to go over the actual real definition, okay?
Okay.
So COPD, is, of course, is the chronic obstructive pulmonary disease, and it's a common preventable and treatable disease. Keep that in mind. It's characterized by persistent airflow limitation that is usually progressive and associated with an enhanced chronic inflammatory response in the airways and the lungs to noxious particles or gases. So exacerbations and comorbidities contribute to the overall severity in individual patients.
Okay.
Now, this definition does not use the terms chronic bronchitis and emphysema and excludes asthma, which is reversible airflow limitation. Okay.
Mm-hmm.
So the symptoms of COPD include dyspnea or difficulty breathing, chronic cough, and chronic sputum production. Episodes of acute worsening of these symptoms or exacerbations often occur. Spirometry is required to make a clinical diagnosis of COPD. The presence of a post-bronchodilator FEV1 over FVC less than 70% confirms the presence of persistent airflow limitation and thus of COPD.
Okay.
So that's what we saw in Mrs. Tubbs' chart earlier about her FEV1 over FVC and that predicted percentage rate, why that was so significant.
Okay, so if you don't mind me asking, what actually
Yeah.
causes COPD?
Okay, so that's excellent to know because you see all the damage that can occur that limit the airflow. Let's go over that. Actually, I want to explain that to you a little bit more. So this next portion in the pocket discusses some of the causes of COPD.
Mm-hmm.
Let's read this here. Worldwide, the most commonly encountered risk factor for COPD is tobacco smoking. Outdoor, occupational, and indoor air pollution, the latter resulting from the burning of biomass fuels, are other major COPD risk factors. Even non-smokers can develop COPD. Now, the genetic risk factor that is best documented is a severe hereditary deficiency of alpha-1 antitrypsin. It provides a model for how other genetic risk factors are thought to contribute to COPD. Now, COPD risk is related to the total burden of inhaled particles a person encounters over their lifetime. So tobacco smoke, including cigarette, pipe, cigar, and other types of tobacco smoking popular in many countries, as well as environmental tobacco smoke. That is the definition of what they're talking about. Indoor air pollution from biomass fuels used for cooking and heating and poorly vented dwellings. That's a risk factor that particularly affects women in developing countries. And we also have occupational dust and chemicals, that's vapors, irritants, and fumes when the exposures are sufficient and intense and prolonged enough. We also have outdoor air pollution, and that also contributes to the lungs' total burden of inhaled particles, although it appears to have a relatively small effect on causing COPD. Okay? So in addition, any factor that affects lung growth during gestation and childhood, such as low birth weight, respiratory infections, it has the potential to increase an individual's risk of developing COPD. And so all these things play a role together in that overall accumulated cause of COPD.
I wonder if Mrs. Tubbs ever smoked.
You know what? Actually, that's in her record. Let's look at it here. So the 5 R's for helping someone quit smoking and smoking cessation counseling. It is relevance, risks, rewards, roadblocks, and repetition. So that first one, relevance, really is about helping the patient identify personal and specific reasons they would want to quit smoking. What's going to motivate them? Why would quit smoking, why would that be important to them? That second R is risks. So I typically would ask the patient, can you tell me some of the reasons you believe smoking is potentially dangerous or harmful to your health? Of course, that includes the acute, long-term, and environmental consequences if she continues or he continues to smoking. And there's also the rewards. I try to discuss with the patient, what are some of the benefits? What do you have to get out of this? What are you personally going to gain when you quit smoking? And then, of course, the roadblocks. So everyone who smokes tends to have something they believe kind of keeps them from wanting to try to quit. So I try to get patients to discuss with me some of the details. What specifically keeps you from trying? What do you think is an impediment? And then, of course, I try my best to try to identify some of my treatments or therapies that might help them overcome some of those roadblocks. That can include, additional counseling, mentorship, some pharmacotherapy drugs, things like that. And then that final portion is repetition. Every time that patient comes in for something, we want to remind them to continue to try to quit smoking. We try and encourage them every single visit. Please consider quitting smoking. Let us help you quit smoking. And that's why I mentioned every time Ms. Tubbs came in to see us, we've gone over some of that smoking cessation protocol with her every single time. Even if she says no every time, we're going to keep asking. Okay, so Just some of the things here that I have here listed for Mrs. Tubbs in her record of our smoking cessation counseling. I did mention to her some of the other therapies we can give. So if she really does want to quit smoking,
Mhm.
we have some things that can help her, like a nicotine replacement therapy. Some patients do have the desire, but they're not able to kick the chemical habit. So there's several products, like I have them listed here. There's nicotine gum, nicotine lozenges, nasal sprays, nicotine nasal sprays.
Mhm.
There's a transdermal patch, often see on commercials even. And there's a sublingual or under your tongue nicotine tablet and inhaler. So if these are preferred, we can get those for. There's also a pharmacological agent that we can get for her called bupropion SR and varenicline or nortriptyline that can be made available for her. Those help a little bit more aggressively kick the habit.
And I know RTs were so involved in smoking cessation. That
Yeah.
is really great. I can't wait to see how you interact with Mrs. Tubbs. And can I ask you another question?
Absolutely. I'd love for you to ask as many questions as you can. I honestly am a teacher at heart. I love getting with students in job shadows and helping them see the wonders of our world in respiratory. So feel free to always ask me anything.
Well, I really want to know, how do you diagnose COPD?